Good evening, everybody. Good evening, all the panelists. Good evening, all the candidates who are preparing and already registered for the EDIC1. Good evening, everybody who are planning to register for EDIC1 in the next season. So we are from 360 Critical Care, and I welcome on the behalf of 360 Critical Care along with my co-director, Dr. Sananta Kumar Das, and all my faculties, all my seniors, and one of them is my senior Dr. Prasant Nasa from Dubai. So a very well-known figure in critical care. He is with us. And Dr. Manjunath T from Manipal Hospital, Bangalore. Dr. Santanu Bakchi from Tata Medical Center, Kolkata. Dr. Biswavikas Mahanti from Utkal Hospital, Bhubaneswar. And Dr. Monalisa Misra from Utkal Hospital, Bhubaneswar. And there are our alumni, three doctors who are about to join, who have joined in our course in last season, and they have successfully cleared the first part as well as second part of EDIC, and they would be also sharing their own experience as well as some tips for the candidates. So welcome all of you. We all know that critical care is ever evolving, and in last 2 years in the COVID pandemic as well as after the COVID pandemic, definitely the label, the specialty is right now far better recognized than 2 to 3 years before. So I welcome, and we all know that I am saying it's not you all, we all are brilliant, but there are many things we need to do to crack a exam, and that's also a competitive exam, and that is also one exam that is widely appreciated as well as people all over the world are like dreaming to clear, and one of that is European Diploma in Intensive Care. Though it looks that yes, we have cleared so many exams in your life, starting from school, college, medical school, then postgraduate, and also many of us have already cleared fellowship exams as well as our like super specialty exams in India as well as any other countries also, like in Australia, in US, and in Europe also. But any exam that is again competitive, and that is again a specialty which is evolving and involving so many the specialties like gastro, neuro, cardio, nephro. So it's not easy, but definitely we need to try hard because it's all worth of getting a diploma which is widely appreciated and recognized all over the world. So are you all ready to start the journey of European Diploma in Intensive Care? I know you are all ready to like know the tips and tricks, and we are here with a team to help you all. So there are certain well-proven points that I want to highlight before we'll go ahead with the course format as well as the exam as well as the different resources that can be we can avail in our course as well as in our own preparation for next 3 to 4 months. Critical care medicine super specialty, it's not anymore a subspecialty, it's a super specialty, is ever evolving. It needs focus, proper strategy as well as practice, because practice is the key to success. EDIC examinations are more comprehensive nowadays, and that needs a proper planning to appear as well as pass, and it has to be a guided like journey, and it should start early for getting success. We maybe 8 years back, when I cleared in 2014 December in Dublin, at that time there was no structured course format, and the preparation what we all were doing, Dr. Nasa would be also agreeing with me, Dr. Sanand is here, so we were all preparing and doing it like on our own, based our own experience as well as like our own way of like cracking any critical care exam. Before also we have cleared many like fellowship exams as well as our postgraduate exams. So it's a more of like unplanned and heterogeneous academics, but we also have to develop certain like structured course, and for that reason definitely a course or a structured pathway is very important. We all know we are working day in and day out in our respective hospitals, and the volume of patients we are treating is also enormous. So definitely we are not getting enough time to prepare well. We do not know what to read and what not to read. It's not only that what to read, what not to read is also very important, because sometimes we devote much time in subjects which are actually less asked in the exam, and the percentage of mark in that domain is also very less. We do not know. We think that, yes, I need to start from page number 1 and I have to finish in page number 500, something like that. Now there is less focus on academics in most of the, like I will say, the corporate hospitals. It's not only public hospitals where the trainees are appearing. More of like corporate hospitals are coming up. There are like, no, the trainees candidates, they are also appearing in international exams like EDIC. And we are more focusing on the clinical management in our respective hospitals in day-to-day practice. So definitely the academic part is somehow like left behind. There is no one anymore like our MBBS days, in our college days, they were holding our hands to teach and make us like, no, learned and like, no, smarter professionally. So yes, it's all like how we do. So definitely sometimes it's not enough. We do not get enough time also nowadays to study, like our MBBS days and MD days. In like, no, 3 months before, we are like, no, stopping, like going to the like, no, wards, to our hospitals, and like, no, studying in the library. So definitely there is less of like time now to study from morning till evening or late evening. So we have so many other things to do apart from our clinical work, our family concerns. So definitely our study is like right now not getting that priority. Yes, at the end, I would say graying of our gray and white matter is also happening along with our hair, because we are all aging. So definitely we are not like our MBBS days or MD days that we are reading and we are memorizing everything. So definitely these are few negative points right now happening. And based on that, we thought, basically I thought, like I tried for the first time 4.5 years back for the first time in YouTube. And you can see there is a video right now also it is available. So when I thought of like starting something for like, no, our young trainees who are about to appear for EDIC 2, and you can see it's almost 5,500 views, and there are 200 subscribers to this this video. So I thought, and I started without any preparation. So but definitely that helped. And you can see the response was also like very rave. I got like no response from all over India, our nearby countries, that yes, we need to start something good for our prospective, for like the candidates, trainees for different exams, which are actually not having a very structured format, and there are no preparatory courses available. So definitely on that basis, we thought of making something like 360 critical care. And this is the like the you can say starting with the first step, where we try to develop some curriculum, some structured format, and some like courses for our EDIC 1, EDIC 2, as well as our own super specialty DNB as well as DM exams in India. So we are here to help you. Definitely we will be having our experience to like the what are the things normally asked, what are the domains one should read, how we should start preparing, and we are here to advise, help, provide some tips, support, assist you all, and guide you in the EDIC journey. So there are certain disclaimers I want to have here in our presentation. This is not an official presentation from ESICM, and the views put forth in this presentation are based all of our experiences while preparing for the exams and teaching over years. The candidates preparing for the exams are definitely free to follow his or her own path, brain or heart. Definitely it's a guide that they would definitely find like the preparation easier. But yes, they can do on their own. If they think that yes, something is good for me, I am strong in certain way, definitely that would definitely help them. This webinar is being conducted to give the overview for the candidates who intend to write the EDIC exams part 1 and part 2 in a better systematic way to clear. So this is the like the objective on which we have started this course. So for the candidates who are not yet like registered for the EDIC exam, but they want to know about EDIC exam, so certain like points about EDIC exam. EDIC exams are conducted by European Society of Intensive Care Medicine, ESICM, a very reputed, you can say, the society in intensive care medicine. The EDIC exams are set out in two parts. The part one is the written exam, and part two is the oral or the clinical case exam, that based on the CCS and CBS. Both the exams are right now being done in online format, but we never know. This post-COVID, they may change it to like the on-site also. The exams are conducted twice every year, as spring and autumn session, in one in the April month and one in the November month for the EDIC 1, and in the May or June for the EDIC 2, and in the December or like you can say November end for the EDIC 2. The European Diploma in Intensive Care Medicine, the diploma name is EDIC. They seek to standardize the education as well as training of quality intensive care across Europe and beyond. They have started that it should be like having a quality intensive care practice in Europe, but definitely right now it is spreading to India as well as the Southeast Asia, and most of the countries right now accepting EDIC as one of the like the standard critical care diploma. Believe me, EDIC exams are meticulously developed. We should not think that they are like making the format like very like you can say very simple. They are every year they are changing the format, and it is updated continuously to create a standard exit exam that would accurately reflect the clearly defined assessment goals and address, like you can say there are four like things they want to check. One is the skill, one is the attitude, one is the competency, and what is the like the normal standard required knowledge that is for like needed for the intensive care practice. And that has to be again done in a very safe way, that they want safe intensivist who can like work in a very, you can say, complex situation, but yes, not doing any further harm to the patient. So EDIC acceptance, yes, when you are getting EDIC diploma by European Society of Intensive Care Medicine, it's a key component of ESICM's education strategy, and that can also set a standard for entry into intensive care specialist practice in Europe. And one of the country is Switzerland. They just say that if you are having EDIC, you can start practicing in their country. If you are like Europe, practicing in Europe. So Europe has made it mandatory, like that is like if you are doing EDIC, definitely you don't need to have any further like intensive care diploma. So many jurisdictions like specify EDIC as a professional qualification, and it's right now increasing in numbers. So maybe in future many other countries would like accept EDIC as one of their like entry level exam to like practicing critical care in their own country. So these are the websites links where you can get further details that may change from time to time. Definitely we need to see and like be updated with the website regularly. Now coming to how to start preparing for your EDIC exam. Many of you have already done these basic points. You have to visit the site esicm.org, create your account. Then you have to complete your EDIC profile, which is a prerequisite for you to register for the exam. I recommend you to become a member of the ESICM. There is also certain ways that be a non-member also you can appear EDIC, but definitely if you are planning to appear for EDIC, you should become a member of ESICM. There are certain advantages why I'm saying that you should be a member of ESICM. You will get access to the S or the packed modules. Previously it was named as packed module, but now it is S modules. Like the events are conducted by ESICM. You can directly watch those events, videos. There are certain academic courses they conduct. The synopsis also you will get. So, and you will also get certain discounts on the EDIC exam fee. Just like if you are a non-member, you are you have to pay 710 like euros. But if you are a member, you have to like pay 510 euro. So that is the like payment discount also they like normally like provide to the registered candidates. ESICM conference registration fee also you will get some like waive up for the registration fee, and ESICM preparatory course fee also definitely if you are a member you will get discount. And this is the website where you get all the benefits of becoming the member in detail. So now what is EDIC 1 syllabus? These are the chapters and the weightage given to the different chapters. Though normally we start preparing, we do not know that what is the percentage of weightage they have given to the different domains. Cardiovascular is the maximum 20%. So if you will go through the last year, 2-year, 3-year questions, you will see almost every fourth or fifth question is a cardiac question. Maybe it is cardiology or cardiac surgical critical care. So neurologic disorders and gastrointestinal disorders 15%. Hemato-onco, metabolic, toxic, endocrine, pregnancy, peripartum is 10%. Renal, though it's a very important domain, but they have given only 5% to the total weightage. Respiratory disorders, yes, it is 15%. Sepsis, infection, 10%. Different organ system support, perioperative care, 15%. And then at the end, 10% to the atypical topics like the comfort and recovery, end of life care, patient safety, health management system. So this is from the website itself. So they may change it, but definitely this is the current status, the chapter wise distribution of the weightage. So how do we help? TRICS 1, this is the targeted review in intensive care syllabus. In 1, we have a 2 for the EDIC 2. So TRICS 1 will bring a thorough review of the whole syllabus. We have a discrete course format. I'm not going into detail because Dr. Sananta will be describing in detail how you will get the different benefits from the course, how the modules have been designed, how you will appear the exams, how will you get the response. So I'm not going into detail, but if you have already applied for EDIC 1 for the upcoming season on 4th April, the big day, 2023, pull up your socks, because already it's now you can say less than, I will say 5 months. It's not good enough, because critical care to read and practice all the questions, all the important domains in 5 months, and having our own clinical exercise, our own job, and it's not so easy. So I would advise never be complacent. Some people they feel, yes, I have completed my DNB, I have now DM, and I have done 3 years of fellowship, and I am now very fully prepared. But this may be the picture for them, fully prepared for the exam. And the first question, yeah, you are going with a duck. So this is the scenario what we have got from our trainees. So that's why I have kept this picture. The format for part 1 exam, it's a written exam. 100 MCQs have to be solved in 180 minutes. 70 questions. Normally, previously it was around 60-40, but now they have increased in last 2-3 years. This is not again a general rule, but what I have seen in last 3 years, because I was the ESISM Asia Pacific representative. So I have attended and conducted 3 exams, though it was all COVID for 2 years. But before that, I have seen that almost 70 to 75 questions are now being asked as A type, single best. And 25 to 30 questions are K types. But the numbers of each time can change marginally. So depending upon that year, how they have decided. For A type MCQs, be clear, you have 5 choices for a STEM question, and you have to choose one best option. The A type questions are actually targeted to test your width of the knowledge in critical care on that domain. And you are awarded 1 full mark if your choice is right. Situation different in K type. You are given 4 choices for a STEM question, and you have to mark each option provided with a true or false. If all the options you choose are correct, you get 1 full mark. If 3 out of 4 options are correct, you get a half mark. If less than 3 options are correct, you don't score on that MCQ. And K type questions are supposed to test your depth of knowledge. So A type is the width of knowledge, K type is the depth of knowledge in critical care. And again, this is the link to know about the exams. They may change, so we need to be vigilant for any change before the exam, real exam. So these are the last on-site exam in 2020 in spring session. And you can see the number of candidates appearing for this EDIC exam from India itself. This is huge. almost 296 to 80 candidates were appearing for one. And this is situation different. They were all wearing a PP. So that's the reason why everyone looks blue. But yeah, so we don't know. They may change from online to on-site in like, the next to next exam. The next exam will be online, as it has been already mentioned in their website. So how to prepare for a part 1 exam? We suggest or we recommend at least 6 months prior to exam. But if not, right now we do not have 6 months. So definitely 3 to 4 months at least. It's a pricey exam. So almost, if you are not a member, you have to pay at least 7-10 euros. So it's not a small thing. And we suggest that rather than big steps, we feel like, no, last 2 months I will accelerate my pace and clear it. No, we have already experienced that importance of smaller steps is very important rather than big steps. We may not finish and reach the finishing line at the end. So that's our experience. How to start preparing for part 1? I will not be again going into detail. Dr. Mona Lisa, Dr. Manjunath, Dr. Santanu, they would be answering and clarifying these things in detail in the later lectures. So these are the things I will be, if they will miss, I will be definitely describing. So of 2-3 slides I will be just describing before I will be handing over to Dr. Sananta. It's highly recommended to appear the module-based exams or the preparatory tests, few mock tests before appearing for the final exam, which is very much needed as a preparation or rehearsal before the exam. You may be very thorough in the theory part, but if you are not practicing the MCQs in a very much, you can say you have not good reflexes to clear or reach the answer in the MCQ based exam, you may not finish it in a successful manner. And also our course or any preparatory course is designed to know your weak areas, which you can strengthen before the final exam. And that's why it's all our attempt of having 360 critical care and TRICS. And we know that despite your efforts, if you do not have right tool, you will not right now going to get the good result. So this is the picture which will summarize that though you are working hard, but if you are not getting the good support, guidance, maybe you will be not reaching the finishing line. These are the things which we are planning to provide you in next 3 to 4 months. We are planning to have a 1-page structured template for all the important diseases, all the important algorithms, all the important equations, all the important clinical problems that would help you to memorize. And at the end, if you have all these things in one place, in your iPad, in your short notebook, and that will definitely help you to grasp and finish all those things in last 10 days, 15 days, because sometimes it becomes very difficult to cover up all the important domains of critical care in last 15 days in our own clinical contest. Some motivation and hard facts before I will be concluding my talk. Few of you have already appeared the exam, but they have not tested success. But you never know, this picture will give you the motivation. You never know that you are almost reaching the the finishing line, but somehow things were not in your favor that day. And maybe this time if you will try, you will be the successful person to get EDIC 1 or EDIC 2. So, but for that, you have to move ahead. It's not this picture in the left side of your screen. You can see this person is standing there at the same place and fail. But for the successful people, maybe if you will start moving with new ideas, definitely you will be one of the successful people to crack EDIC 1. Thank you, all of you. I hope I have tried to give you on summary and introduction about the course as well as the EDIC 1 preparation and few motivating facts about EDIC 1 preparation. Dr. Sanant, could you please take over?
Yes, Tapas.
I'm stopping sharing the screen.
So thanks a lot for that elaborate presentation. Can you see my screen, Tapas?
Yes.
All right. Good evening to everybody there, especially my very helpful colleagues who have been the pillars for structuring these two courses, TRICS 1 and TRICS 2. As the name suggests, one is for EDIC 1. Tapas has given a very good overview about it. I'll be very brief in my presentation. Just for all who doesn't know me, my name is Sanant Dash. I work as an intensivist in Queensland in Australia. Most of the training happened in India. In fact, Tapas, Dr. Nasa, these are my seniors in one of the other fellowship that we are doing together. I have been here for last 10 years in Australia and have been a consultant intensivist. The basic thought about this course that we structure with Tapas is, as he said earlier, there is a lack of continuity, lack of structure for most of the candidates who appear such an exam, such as an EDIC, which is a internationally acclaimed exam. The standards are very high, the bar is very high. Though we know things in and out, but we are not able to reproduce at the right time. So that is the issue, what I have seen with my colleagues, with my trainees. That's why we thought of putting together something that will be helpful for the candidates. It's hard and impossible to churn the whole syllabus in 4 months and spoon feed anyone, but definitely we can tweak around your baseline knowledge and can advise you which way to go so that the path become easier. So no doubt it's an ocean of knowledge that every intensivist is expected to know. And before the exam, 4 months before the exam, panic should not be the thing that you are thinking of, right? So we bring this course, which is called as the TRICS, or the Targeted Review of Intensive Care Syllabus for EDIC 1. The basic aim to organize and structure your approach for the exam. It is backed up by regular assessment, as Tapas showed you a slide on mock test or regular assessment, how it is helpful, and provide a one-to-one interaction with all the experts, including the panelists that are present today. There will be lots of other people who are very renowned person in their faculty. They will be helping you, pointing out what are the important things to look for, and strategize how you approach a subject or how you approach a chapter. Now, Tapas has gone through this disclaimer. Just to add a few things onto that, we run both the courses for EDIC 1 preparation and EDIC 2 preparation. Actually, the EDIC 2 preparation course has been very, very, very successful. Dr. Nasa is a regular faculty mentor there. We have or had more than 50 enrollments last session. We run both the courses twice a year, matching the timing of the exam. Rest of the things the Tapas has already explained. We are nowhere related to ESICM, but we definitely speak highly about that authority and their exam. So it's only a help to the candidates to reach their goal to pass the exam. That's what the main aim of the whole course. Now, how the course run? So basically, it is a 4-month duration course. The whole syllabus that Tapas showed you is divided into 8 modules. Each module is assigned for 1 week. So once we enroll into the course, we will give you access to a reading or a study material folder. We call it as a TRICS cloud, which has chapter-wise definitive reference articles and other sort of presentations, which can concise your effort to look for the best source of information. Today, internet is a jungle. So if you go type something in Google and there will be 1 million paper coming out of it. So you're not sure what to read, what not to read. We tried to pool the most important review article, most important studies and other helpful presentation into one folder, which is the TRICS cloud, which is readily accessible to you guys and can be used as a supplementary material to the material that is provided by the ESICM. So very, very helpful. The day you enroll into the course, you'll given the access for the TRICS cloud. This time, I think the date is on 26th where the access will be open. Now, once you enroll into the course, the first module starts. The date for starting the first module for this TRICS session is December 1st. On that day, we will count as a day one, and those 7 days or 6 days preceding the exam, you will have some pre-reading from the TRICS cloud or whichever resource you want to go through. Then on day 7, there will be online mock exam. Each of the module will have one mock exam, which is around 50 to 60 questions, combination of both A and K type. And post-exam, immediately after that, you will get your evaluation sheet, which is an automatically generated evaluation sheet that will go to your email saying that this much of marks you have scored on these questions and these are the answers, and that's your response. So immediate assessment of your paper. But that doesn't stop there. After that exam being completed, following day or within 72 hours of the exam, there will be a debriefing where the questions will be thoroughly discussed. The beauty of the debriefing is we have faculties who have made the questions and the debriefing will be done by the same faculty. Also, there will be other faculties present to give their input. So suppose the first module is cardiovascular system. The questions are made by our faculty whose name is X. Then the debriefing will be done majority by the faculty, the same faculty, but definitely me, Tapas, or few other faculties and mentors will be there who will be assisting that debriefing, answering questions or asking people about their approach. And that's a one-to-one very interactive session. That's the most important part of the discussion, I think. These videos are recorded, goes into our storage, and that is readily accessible to you. After the exam or after the debrief, you can readily access that. So 8 modules goes over 8 weeks or somewhere between 8 to 9 weeks, depending on the duration of the modules. Suppose the cardiovascular module is a big module or it takes time to finish. So we, instead of giving 6 days, people can take up to 8 days. On the 9th day, that will be the exam. So in that way, depending on the weightage of the system, the duration of that module will be determined. It's not very fixed at 7, it can be 6, it can be 8 days. But we'll complete 8 modules in 9 weeks, that's the aim. And after completion of 8 modules, there will be 2 complete chapter modules. In the sense, those 2 modules will be exactly the EDIC syllabus covering the whole chapter, like all the 8 modules will be converged into 2 mock exams. Each one will be having 100 questions similar to EDIC, simulating the EDIC exam, followed by a grand debrief. So both the mock will have a grand debrief with maximum number of faculties present there, and we'll be discussing about those questions after the exam. And if the candidate wants, we can provide them a rank based on how many candidates are there in the course and where they stand. That's up to them. It's completely confidential. But if the candidates are interested in that, they can always tell us to do that. Now, Tapas has explained this, the distribution of whole syllabus into 8 based on the weightage. The duration of this module will be, but it varies between 6 to 8 days. There will be 8 mock modules test, as I said, and there will be 2 full chapter module test at the end. Important dates, as I said, the registration has already started. The access to the cloud will happen on 23rd. Whoever has registered will get the access, and the course will commence on 1st of December. Now, just to give an overview of how the last EDIC exam went. So this is all memory-based question provided by our candidates who have enrolled to the last TRIC 1 session. So questions covered all the 8 modules. For example, the first module, the CVS, had multiple questions. You can see the maximum number came from the CVS. There were at least three ECG questions, starting from Wallen's syndrome, Wallen's sign, pericarditis, cardiac tamponade, ECGs of STEMI and non-STEMI, management of VF, vasoactive drugs, mechanism of action of levosimendan, contraindication for adenosine. There was questions from hemodynamic monitoring, CVP waveform, PA catheter waveform, and the derived value from PA catheter. Then disease-specific cardiovascular diseases. There was a investigation of choice question for pulmonary embolism. There was a diagnostic question for cardiac tamponade, mechanical support questions on IABP. There were three questions on ECMO, VA ECMO, and VV ECMO, in combination three questions. So as they suggest in their syllabus, the questions are asked from the particular module. So they're very specific. So we go or prepare the exam in a structured manner so that we can devote the timing up to special chapter or specific chapter based on how many questions we are getting. So that's where the course helps you. Similarly, the neuro, only 4 questions on that. There was one question on post-traumatic stress disorder, viral encephalitis, status epilepticus. There were a TBI questions with third nerve palsy, few questions on GI. So I'll share this in the group, but just to make sure that none of the modules or none of the chapters were spared. All the chapters got some question, and there are not many questions from one chapter. So all of them are distributed. So it has to be a holistic approach. That's the main thing I wanted to point out here. And most of the topics were discussed in our debrief, most of them. Now, going a little bit about the exam, how it happens. Suppose we take a module. So as per the EDIC1 syllabus, we have designed the module. Exam takes over the week. So the candidate can take the exam anytime after opening of the link, whenever they are free, day, night, evening, whenever. So 24 to 36 hour window, whenever they are free, they can take the exam. And the discussion is following 24 to 48 hours or 72 hours after the exam, depending on the availability of the faculty and other students also. Then we recommend doing the exam on a laptop or a desktop, just like an exam scenario, rather than with a mobile sitting on the car. So a bit of seriousness is required for the exam. And these are our esteemed faculty. So we have 10 this time and 2 directors, me and Tapas, but they are very, 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 very learned people. Out of 8, or out of 10, 8 have already passed their exam, EDIC exam, at different time courses. Me passing it in 2013-14, Tapas passing in the same time, and few people like Shreyas, who was one of our alumni student who has passed the exam last year, the first go. So there are different range of people who are going to prepare the question, who are going to be the direct examiner for you. They have covered this exam at least for 10 years from now. So that's the genuine attempt from us to make sure that people starting from who have appeared the exam last year to who have appeared the exam few years ago are in the panel. Again, I talked about that post exams is an automated answer sheet that is generated, will be distributed to your email. We will talk about the area needing improvement from the candidate in general, which part they are struggling or which part is a problem for you guys. You can tell us, we can plan out a plan to how to tackle that. Everything happens over the Zoom platform, so it is pretty interactive. Everyone has a good hold of using the Zoom, so there is no problem with it. The participants in the debrief are all the candidates, examiner, the course director, either me or Tapas, and few invited faculties and experts. And all of you will have full access to all the debrief videos. Again, the date 16th is the enrollment, which has already started. We have put a nominal fee because it is a 4-month or not 4, 3.5 month old long course, aiming to finish in at least 13 to 14 weeks. I believe that's a rational price for the course because lots of effort going into there. Lots of faculty involved in there, lots of effort, lots of background work are there. So we think it is a bit nominal in that way. Yeah, and there we have designed a mock exam for whoever wants to appear a mock of 51 questions. It is in our website. There is a link underneath in the website. You can click there and directly enter the exam to see how you're performing with one of our mock tests. And there is introductory discount at this moment. In next 1 week before starting of the course, if somebody registers, then they will be getting some off. That will be a discussion with our enrollment officer, but at least they will be getting a discount for who are enrolling in next 1 week before the starting of the course. Tapas, I think this was my last slide. I'm happy to take any questions from the candidates if they want to.
Yeah, thank you, Dr. Sananta. So, Dr. Suhas, yeah, if you have any query, you can post the query in the chat box. Or
hello, sir. Like, can I ask you an oral question?
Yeah, Dr. Suhas, please.
Sir, like, what is the approximate passing marks that's required?
Yeah, so for last 5 years, I am continuously one of the examiner. In India, on-site exam, I have taken 3 exams and on-site, online also. So the passing percentage safe side, if I will ask me, 65. 65, and there are like 100 questions, but somehow like after excluding the controversial questions, they normally disqualify 4 to 5 questions at the end after they are like the mega meeting post exam. So there are certain controversial questions they just like omit. So 95 out that 65 is, I will say, the safe mark. 60, 62 will be borderline. So never target 60, because sometimes they like increase the passing percentage depending on the the number of candidates actually scored more than 65, 70. So it's more of like percentile. It's not like that they have made it a flat number 60, 65. And believe me, every year now like they are increasing somehow the bar. Because now from India they have made it like if you are clearing edict, you are directly like entitled to practice in UK. So that's one of the reason. This is one of the like most highlighted exam right now in India as well as Southeast Asia, because if anybody is interested to like practice in UK, they don't need to like go for FRCA or like MRCP or PLAB clearance, anything. If you are having edict, you can go there and like do the practice. So that's the reason. 65 I would advise all of you to target rather than 60 or 58. It would be a little bit difficult. If there are any queries, or else we'll go ahead with our next talk. Do we have Dr. Ruchi? Dr. Ruchi, are you there? Dr. Shreyas?
I think Tapas Shreyas is here.
Yes.
Dr. Shreyas? Yeah.
Good evening.
I will introduce Dr. Shreyas. He's our like one of our like most you can say one of the brilliant candidate who has cleared edict 2 with very good marks in the first attempt. And Dr. Shreyas, could you please introduce and please share your experience and a few tips for the edict 1 as well as somebody who is planning to appear edict 1.
Yes. Good evening, everybody. So, am I audible?
And one more thing, one more like good news, Dr. Shreyas, along with clearing edict, he has been also selected for Canadian Critical Care Fellowship, where I have done my fellowship in St. Mike's. So he's going in March end. So that is again one added one thing success story for Dr. Shreyas. Yeah.
Thank you, sir. Thank you for that kind introduction. Am I audible?
Yeah, you are audible.
Okay. So, hello, good evening, everybody. This is Dr. Shreyas Bhor. I've completed my FNB from Pune, and I passed my first part of EDIC in 2019, and this year only I completed my EDIC with part 2. So the thing is, so to actually, it's been 3 years, and I'm pretty sure that in 3 years, the exam pattern or the question pattern must have been, must have changed a little because the difficulty level, as Tapas rightly said, the difficulty level of EDIC is going up and up, high and high. So with every session, with every year. So the thing is, to pass EDIC 1, I would like to say that you have to be very thorough with your knowledge. And theoretical knowledge especially, because then like the practical knowledge or the other things will be tested in part 2. Then the thing is, you have to be like practical, and you have to plan yourself first. So how you are going to study. And the second thing is, other than knowledge, the most important thing is, first you have to know how the exam is going to be conducted. What are the question patterns, as Sanand sir showed the slide, that these were the modules, and from each module, from each system, there were a few questions. So we cannot exactly skip any system or questions like that. The second thing is, as I said, to study the exam, you have to practice a lot of MCQs. That would be very helpful. So the first thing is to plan yourself. As the TRICS module is like the system of TRICS module. So assigning few days to each system or to each module, and studying accordingly would be, greatly helpful. The second thing is, there are a lot of nowadays there are a lot of MCQs available on the ESICM website also. So studying those in the initial part before you jump into the like preparation of the EDIC 1 will also be helpful, because that will give you the idea of what kind of questions are asked, or what are the depth or areas have been covered by ESICM. Bennington and all the books are recommended by everybody, many a times. But my personal opinion was like Bennington was little bit, it was little bit of far kind of a thing. It was, the difficulty level was a little bit high. And also it is like, I think the second edition is from 2015. The first edition, the blue book, which is available for Bennington, it is from I think 2008. So that is definitely very old. But 2015 second edition is a little bit better. But still, I would say from practical point of view, ESICM MCQs are much better than Bennington, and obviously the other theoretical part.
So just interrupting, Dr. Mona Lisa would be discussing the resource materials and the textbook names also in the slides. So that would be definitely helpful to the candidates. Yeah.
Yes, that's it, sir, from my side. Anything else?
Yeah, thank you, Dr. Shreyas, and all the best for your future endeavors. We hope
I wish all the candidates the very best. So wish you best luck. Yeah. See you at the modules.
Yeah. Thank you, Dr. Shreyas. Is Dr. Ruchi is here, or else I would request Dr. Manjunath from Manipal Hospital, again one of the bright, young, dynamic intensivist, who would be sharing his own experience as well as a few tips and tricks for the aspiring candidates.
Hello.
Yeah, Dr. Manjunath.
Am I audible?
Yeah, Dr. Manjunath.
Good evening, all. So I think Dr. Tapas and Shantanu and Shreyas has already briefed about everything to everyone. So see, the preparatory course for the preparatory, the time and whatever you do. So they've already told around 3.5 to 4 months all that about the material. I think the Dr. Mona Lisa will be discussing. But the main thing is, and you need to have a definitive approach, how you're going to do the approach for the exam, in the sense preparation, the planning, and the mainly dedication and commitment. So, and as a EDIC diploma and holder, so what I can say is the dedication and commitment, it should be 100% for this exam. So because it is very structured exam, it's not like any exam and where the examiner will ask you and whatever he wants. It is a very structured one, and all the MCQs, it will be on the specific and topics and about and the recent and the research as well. So you need to be updated about everything. And the second thing is, if at all, if you feel, and all the students appearing for the exam, if you feel that you are weak in any of the topics, and you can actually do in the discussion with us and post the exam and make your own notes for the specific topic, so which actually helps for all of you. And every system has got like few core topics, like and the respiratory system like IRDS, and other systems like the GIT, GI bleed, and all other things. If at all, if you know about those core topics in and out, in the sense some like top to bottom about all the guidelines, approach, all that, it is the best. And as Dr. Tapas told, the 65% is like a passing percentage in that. If at all, if you know these core topics and very well, so then your approach will be the best. So, and always the make sure in every system, the core topics, and make sure you know and each and everything of the core topics from A to Z. In the following that, all the miscellaneous under topics, miscellaneous topics are important to earn the marks, in the sense in the miscellaneous under topics, the most of the time it will be repeated MCQs. As in, so when I gave my exams in 2017-18, so the miscellaneous and the topics, the same MCQs from all these IMCQ books or from anywhere, it was almost a repeat. So your approach should be the mainly focusing on the core topics and then follow accordingly.
Yeah, perfect.
Thank you. Yeah.
Yeah, Dr. Manjuna, thank you. Thank you for your tips to the candidates. Dr. Ruchi is here. Yeah.
Yes, sir. Good evening,
Yeah.
sir.
Yeah, Dr. Ruchi Saran, she just cleared EDIC 1 in the last exam few months back that was conducted. So Dr. Ruchi, could you please share your few of the tips?
Yes, sir. Sir, actually, because of many reasons, I actually started very late in the preparation for the preparation phase. So, trick course that it came to my rescue actually. So they very earmarked the topics which are important for the exam, and it helped me in a very targeted preparation. So with the discussions and also many areas which would have been left if I had not attended those sessions and the mock exams, so it made my study a very focused one. So they very like the all the mock tests were very well designed as per the like weightage of the topics they cover in the exam. So I focus my preparation in that way. So whichever topics yield more marks, we were guided, and that I prepared, and it all helped. Like so many questions were directly from the mock exams, the topics which were discussed. So it was a very like cut to cut preparation, very like 1.5 months of preparation. I cleared it with the help of your guidance, sir.
Thank you. Thank you, Dr. Ruchi. She's just about to go to her night duty in the hospital. So thank you for taking some time out and helping the candidates in their preparation.
Thank you, sir.
So
All the best,
now,
everyone.
yeah, thank you, Dr. Ruchi. So, Dr. Nasa, are you there? Dr. Nasa?
Yeah, hi, Dr. Tapas.
Yeah, Dr. Nasa,
Yeah,
could you please, I know like you are busy in the hospital, I think. So
Yeah.
if you can share your like 1 or 2 minutes of experience related to the EDIC preparation. Yeah.
Thank you, Dr. Tapas. I think I'm the one who has finished this exam, I think, quite earlier. I was one of the last candidate for the older format in 2013, where I gave my EDIC 2 in Istanbul. Yes, but during part 1 preparation, as you know, as you mentioned, that we did not have facility of structured courses at that time. And thanks to you and couple others, now there are structured courses which are available, which I have attended as faculty, couple of them. And I'm really happy that, you are giving a comprehensive guidance to the students, how to approach this exam, because the resources are available in plenty now. I don't think there is a dearth of resources, but how to read, and most importantly, what not to read and what not to waste time during this particular exam. I think for any exam, this is something which we need to consider. There is no more dearth of resources that I say. At that time we did not have much availability of MCQ books or other resources, but now there are various books available. At the same time, we have ACE Academy, which is very well structured now as compared to the original PAC modules. So the resources are available, but most importantly, how to read them, and most importantly, what to read from them, and how this will be formatted into a depth and width of, the assessment exam. I think that is something which we need to learn before the exam. And by your mock modules, which I have seen that, people get tuned to the format, to that panic format, which happens during the exam, the performance pressure, which happens during any MCQ exam, finishing those 100 MCQs in that 180 minutes. It looks very easy to start with, that you are devoting nearly 3 minutes or 2.5 minutes for each question. But when you actually sit in that format, the time just passes and flies away. So it's important to practice this MCQ pattern, not just to understand the theory. And I think that will be very helpful. So I encourage everyone to do these courses besides your study material. And I definitely best wishes is there for all the candidates who will be going for April exam. All the best, guys. Thank you.
Thank you, Dr. Nasa. I would be like reiterating 2 points. You have rightly like discussed 2 points. One is like right now, many textbooks are there in the online. Like you will like Google, you will get like almost, I think 15 to 20 books. They are based on multiple choice questions, but the standard and the quality of questions, and that is again like opt for the EDIC one or not, that is very difficult to say. So that needs definite like preparation based on the modules, the level of exam, and you need to be very serious that which textbook you are following. Otherwise what will happen, you will be spending 2 months, 3 months time from like from day one after 2 months you will be at nowhere. So definitely you have to choose rightly. And the second point, again you have told the right thing, that it seems like easy. The questions will not be very difficult for a trainee who has already completed fellowships or super specialty exams in India as well as abroad. But after 1 hour or 1.5 hours, the questions, if you are not getting the correct responses, or you are feeling that yes, I am confused in last 5 questions, definitely your level of commitment and the reflexes will be declining very faster towards the 2 hours or 2.5 hours time. Because I have seen the patients in the exam hall after 2 hours, because we do not have right now practice of sitting for this 2 hours, 3 hours exam. Every 15 minutes we just get addicted to our mobile, checking our WhatsApp status or Facebook status. So that also happens. The psych level of the students after 1 or 2 hours is somehow erratic. So after 2 hours, people will not be focusing on the question paper, rather looking here and there to get some some refreshment or some clue from some other examiners or some candidates. So for that reason, this type of preparatory courses, mock test, where you are sitting there and typing the answers, as well as trying to be cool during the whole 2 hours, is very important. This is one of the things what I got from your the points. So I just thought I would highlight that. Yeah, thank you. And now I would request Dr. Mona Lisa to discuss about the resource materials, as well as from where they should start reading along with our preparatory course. Yeah.
Thank you, Dr. Tapas. I think you have covered most of the topic, so I'll be really quick. And so, as you said, our course is a very good, place to prepare for EDIC Part 1, because we are covering all the competencies, we are covering all the topics, and we're touching and brushing over all the topics. And the last exam MCQs which we got in the last EDIC session, I remember I did the cardiovascular, and I think you did the gastrorenal and neuro part of it also. And I think most of the questions were covered by us. When the students are coming and telling us that, okay, you did teach us this topic, it makes us feel very proud that, we managed to touch most of the syllabus. So quickly we'll go through what are the revision courses required for EDIC Part 1. So you have 3.5 to 4 months. So it has to be very, very targeted. And we need to help you guys to make sure that, you are not wasting your time reading things which are not required, right? So like any other exam. So the syllabus is called the Cobatris syllabus. We all know about that. Dr. Tapas has also touched a bit on that. Competency-based training in intensive care medicine in Europe. The whole point of giving the exam is that the examiner wants to be sure that you are ready to act as an independent consultant in ICU. You are safe with the patients and you can manage a shift alone as supervising the entire ICU, and your decision-making skills are good. So that is the purpose of that exam. So this competency competencies which actually test the minimum standard of knowledge and skills and aptitude required for a doctor to be identified as a specialist in intensive care medicine. And they have been developed with the intention of being internationally applicable, but also they accommodate the national practices and local constraints. So they comprise of 102 competency statements, which are grouped into 12 domains. Now, what are the 12 domains which they mainly cover? So you should know about these things: resuscitation, diagnosis, disease management, interventions, procedure, perioperative care, comfort and recovery, end of life care, pediatric care, transport, safety and management, and professionalism. So all these is covered in the co-batteries domain. You can find detailed syllabus in the ESICM website when you register for ESICM Academy. So this is a blueprint of the exam which Dr. Tapas has already discussed, and this is what is also given in the ESICM official website. So it is very reassuring for us that we are almost up to the mark, and our blueprint almost matches this, because this is what we also did last year. We covered in this way the cardiovascular 20%, renal 5 to 10%, neurologically 15%. So these are all the systems, how the division was taking place. And there was a question on organ transplant. There will be questions on perioperative care. So you need to cover all these systems, isn't it? So basically, either you can choose to prepare from the co-batteries syllabus, or the easier way, which I feel, is you can go through the ACE modules or the former packed modules. But there are 92 modules, and I'm telling you, so we have 3.5 months left. So you can calculate, if you have to go through all the 92 modules, how much time you're going to dedicate. And you have to go through them twice, because that is going to form the basis of your knowledge. On top of it, you have to practice the MCQs by joining, our refresher course or any refresher course you choose. But, that is how your preparation should be. The basis of knowledge comes from these ACE modules, and then practicing more and more MCQs are going to make you more and more confident about what you read, that you can apply it and make the MCQs right as well. So this is your primary syllabus. There are some dedicated MCQ books. Now, we will not recommend which is the best or anything, but I found Steve Bennington's book, the Green Book, a bit useful for myself. So I would say that if you have time, you can go through that. Primarily what my strategy was, I went through the ACE modules or the packed modules twice, and then I joined a preparatory course and practiced a lot of MCQs. Like how our course is there, we have divided it into specific domains, and we're going to give you 1 week per system. I think that's the best way of preparing for EDIC Part 1. So this is my experience. So there are a few MCQs book which you can go through. This is a trade secret which I'm going to give out today. So ICM journal. So this is the journal of ESICM. And so like if you are an ESICM member, you will have access to this ICM journal. So the trick is, go through the ICM journal from August to maybe, January. There will be some questions from the important, the articles which come in this ICM journals. So, you can read it for leisure. You're going to sleep. You can just open your mobile app and go through an article. It's not going to take some time, but it's going to make some of your facts and your, concepts very clear. There's some very nice articles about it. And of course, we are going to help you in revising some of this also, because we are going to include these questions and add, the flow charts and the tables from these articles and make it easier for you to revise. So if you don't have time to go through the 4 or 5 editions of this ICM journal, we are going to help summarize the important questions which have come in past from these, and help you in future also to tackle with such question. Then books for reading, you can read O's Intensive Care Manual if you have time for reference, but I don't think we need to read it again. It is just for a reference. Other sources which I found very useful was Deranged Physiology which is from Sanat sir, is a home country now, and Life in a Fast Lane was useful in some topic. And then ESICM Annual Congress and Lives Forum, there are some online media libraries, some videos which you can look at, and ESICM master classes. If you find, these topics interesting, like hemodynamic monitoring and mechanical ventilation, you can go through them. So basically, how our course is going to help you. So we know we are going to go through the entire syllabus, and we are going to and the study material which we need to cover for this exam. 92 modules are not very easy to go through in 3.5 months. So, but we are going to make it simpler for you, because we're going to highlight the important points and present it to you. So if you have it in form of 8 domains, it will be definitely easier for you to revise them quickly before your exam. So the candidate will have access to the TRICS cloud, which is a very unique resource material, because everything is very concise. As Dr. Tapas said, it will be very quick for you to revise them quickly. And then, as Dr. Sanat has already discussed, there'll be 5 modules covering 8 domains of EDIC syllabus, which will be having A-type and K-type questions. So we have kept in mind how the trend has been from last few years, that the number of A-type and K-type questions, and will give you enough MCQs for practicing. And we'll debrief you, and we will give you tips and tricks for exam after the end of each week. So this is how our syllabus is going to help you. So this is where I end my topic. So thank you so much, Dr. Tapas. Over to you. And I'm here to clear any doubts.
Yeah, thank you, Dr.
Tapas,
Mona
I
Lisa.
just wanted to highlight. So the format that Dr. Mona Lisa has seen is from last year. Actually, we had 5 modules in last year. So
Okay. Sorry. Yeah.
We have increased that to
Yes.
8 modules.
8
this
modules.
time.
Yeah.
So we have increased it to 8 modules this time from 5. In the sense that we have divided the cluster module into few individual ones. So last year the respiratory was combined with something else. So we have divided that. So now it is 8 modules, 8 weeks at least, trying to finish it in 9 to 10 weeks in total.
Yeah. So thank you, Dr. Sanant and Dr. Mona Lisa. I would be just sharing 2 slides about 2 more books. If some candidate is interested to get few references also. So can you all see my screen, Dr. Sanant?
Yes, we have.
Yeah.
I can.
So these
I
are
can
few MCQs, other MCQs books. If somebody has already started these MCQ books, they can. This is one of the recent book by Abraham Sunny, 1000 questions, and this is one critical care board certificate review, 1000 question again, 2022 edition. And these are already mentioned by Dr. Mona Lisa. This is one of the book also, Keith Davis by Cambridge, single best question for the final FF ICM, that may help you. So, and these are the internet resources Dr. Mona Lisa has already described. ICU one pager, MCRIT. These are all 2 other websites that will be also having few important domains very clarified and very crispy. Yeah, you can get all those references. So now I would request Dr. Santanu to please share your message for the prospective candidates. He's one of our faculty. Dr. Santanu.
Yeah, good evening, Dr. Tapas. Before we start, I was just checking this attendees. I found Dr. Pedro is there. Good evening, Dr. Pedro. Would you like to unmute yourself?
Yeah. So Dr. Pedro is from Portugal. So he has shown interest in joining our course because he didn't find any preparatory course there. So Dr. Pedro, are you there?
Hi everyone, I'm here. I'm working now. That's why I don't turn off my camera. Turn on my camera.
No worries.
No problem. Yeah.
No worries. So,
but I'm seeing you in listening very much attention.
Great. Thanks for joining. See, most of the things has been discussed pretty in detail, so nothing much I have to add on. Basic thing is that ideal approach would be to follow one textbook, that can be Rose to follow the entire packed module, the ACE modules which you are having, that will develop your base for the subject. But that's an ideal approach. Now you have 4 months time, so you cannot cover it everything. So that way, this module based approach, following one topic, one particular module for 1 week, and then appearing for the exam at the end of the week, and then following the debriefing session, clearing your doubts, this will be very much practical oriented for clearing your exam. Simultaneously keep your packed modules with you, because that has no replacement. That will definitely develop, that will definitely strengthen your base for this subject. No confusion in that. But this module based approach will be the most important aspect for your practical exam preparation. That's all I would like to add on.
Yeah, thank you, Dr. Santanu. Dr. Vishwavikas, would you please share 1 or 2 minute your advice for the prospective candidates?
Good evening, very good evening. So thank you, Dr. Tapas and Dr. Sananta, for organizing such a nice platform for all the EDIC aspirants. So when we were preparing, actually we were struggling a lot to get the MCQs. So because you have to, at that time, we have to go to Dubai to appear the EDIC 1. And so nowadays the things are very easy, and especially the tricks, whatever since last 1 year we are doing, I think it's doing a tremendous job. So one of 2 of my colleagues who has cleared EDIC 2, so they have personally sent me message that because of the tricks, only on the first attempt they have cleared both EDIC 1 and EDIC 2. So this is such a inspiring event actually from them. So like nowadays, like what Dr. Mona Lisa has highlighted already, all these resources, and as all of our mentors and especially Dr. Nasa has highlighted, be very thorough in a topic and very precise. So EDIC 1, it will be mostly knowledge-based, theory-based exam. So if you will be very much clear in your theories, you will clear. But for EDIC 2, especially our tricks will be very much helpful. So thanks a lot for Dr. Tapas for organizing such a nice module. Thank you.
Thank you, Dr. Vishwavikas. I have got 2 messages instantly from our colleagues from Bangladesh, and one of the colleague from I think Dr. M. Bali Khan. So they want to start this type of courses and also register for the courses. Thank you, Dr. Farhat and Dr. Bali Khan. Yeah. So Dr. Sanant, anything more to add, or else we can have
I think Tapas, we have covered most of the things, and
so I would just like to say one last thing. What I did, and me and one of my colleagues, Dr. Rolly, we were studying together. So what we did is, suppose we were going to, appear for a module, like a renal module for exam. So that week we will go through all the ACE modules. Mein RRT pe 4 module are there. Then there is AKI, few modules are there. So we'll go through all that, revise all that, appear for the test, and then test our knowledge, how much we have gained from that. And then we read through all what the faculties are teaching us about the questions and all that. And after that, again, we used to revise our study material once, the preparatory course material and the ACE module. So that is how we strengthened each and every system. And in the next, after 4 months, we realized that, we will be able to tackle most of the important questions with much more confidence. So that was my trick, which I would like to share. And yeah, over to you, Dr. Tapas and Dr. Sanat.
Thanks, Dr. Mona Lisa. Tapas, I don't think that not much thing I have to add. So basically, the trick in the exam is you have to reproduce within that definite time frame, 1 minute for one question or 1.5 minutes for one question. If you haven't attempted that sort of question, a similar type of question, there is a good chance that you will fail that question, because take it in the practical exam also. If you haven't seen a heart failure patient, you will not be able to pass in a viva case of heart failure. The same principle here. If if you haven't been asked on arterial line trace, questions on arterial line trace, if something comes in the exam, you'll be confused and will not be able to. So this format of teaching is basically to make your practice and make you or make or we try to point out that this is the thing you need to know about the particular thing rather than an overview approach. Particular things that is asked in the exam and you need to know about it. That's where it is beneficial. Otherwise, the basic knowledge, I don't think there is much difference between the candidate who passes or who just borderline fails. The main difference is the particular thing or the nitty-gritty of the thing that is asked in the exam. The candidate who passes the exam knows about it, has already been asked about it, or he has failed that question while practicing earlier. Then only you can answer those questions when it is the real time. That's my message, or that's my 10 cents that I can add here. That's it. I think we are running late also, Tapas. So if there is nothing else to be added to this presentation, then we can call it off.
Yeah. So thank you, Dr. Rasanant. Just before concluding, one of the always we heard from our candidates tell us the important topics from each domain, what to read. Because there are if you are saying that cardiovascular, there are n number of things in cardiovascular. So in our group, once you join, we would be sharing the important domains that never miss those domains or topics. So that would be in that specific week, so that on Monday or Sunday night you will get those 10 to 15 or 20 things that will be in your bucket list. You have to finish in next 6 days before appearing the online test related to that system. So if it is cardiovascular, we will give you 15 things that you have to finish in those next 6 days, so that on the day of Saturday you will be having the exam, and Sunday or Monday you will have the debrief, and then next week it will again follow for the other system. So I think that would be definitely helpful to know the most important things that you have to touch. Otherwise it's a vast ocean, as Dr. Sanad has shown in the first slide. So you may not complete the whole cardiovascular system in 6 days. Believe me, some people say that why you have made it like a weekly one domain, because otherwise what will happen if you start concluding with all those domains for cardiovascular system, you may take 1 month time and you have only 4 months time left for finishing. Then again you have to revise also one time. Otherwise it is of no use if you will just finish all the domains on the last day of your preparation. So that is again one of the most important trick what I want to share. You have to revise whatever you have gained from all those 3 months of hard work. You have to make short notes. So at the end, for last 10 days, you have to only touch all those things what you have read in the red line, and those things you are actually in weak areas. So that you need to focus. So these are the things you will be getting once you register, and you will be in our WhatsApp group. There will be a dedicated WhatsApp group where all the candidates will be interacting among themselves. They would be also sharing some certain flow charts, algorithm, and articles what they are getting. Some queries also that will be solved by you all rather than only faculties or the mentors. So it would be a good platform where you can all solve your own problems and discuss among yourselves. Thank you. So I think with this we do not have any more queries, and we have already reiterated all those important topics and points many times in our 1.5 hours of discussion. So with the permission from everybody, I would be closing the session, and we wish all the best to all of you, and we hope you will all clear in the upcoming EDIC 1 April 4th 2023 exam. Thank you, Dr. Nasa, for sparing time in your ICU duty also from Dubai, and all of you, all the faculties, all the candidates who have spared their time and shared their own experience as well as advice to the candidates. Take care. Bye.
Thanks, Tapas. Thank you all.
Good night, everyone.
Thank you all.